Welcome everybody. I will present in advance the report on the communication activity of the European Medical Association during the 3 years 2021-2023, and this is also an overview of the activity of the European Medical Association as agreed with the President, Dr. Vincenzo Costigliola. It will be presented on site at the General Assembly in Brussels, the 18th of May of 2024. I am Guglielmo Trovato, medical doctor, and currently I have the task of performing several activities related to communication, media relationship, and e-learning activities. The commitment of the Directory of Communication, Media Relationship and E-Learning of the European Medical Association is quite complex. We have different targets and audience. Mission and goals may be different. Tools and process are integrated. Interactions and feedback will be important because opportunities, challenges and barriers must be very well identified and detected. We used and use social media, mainly LinkedIn and Twitter, and several e-learning platforms. The task of developing science and disseminated science information is a very important task, and also the task of developing, submitting and performing European projects is another of the important tasks of our association. I will try to explain some of our activities of the past 3 years, the most important of course. Regarding mission and goals, the European Medical Association promotes up-to-date and patient-friendly levels of medical professionalism and several humanitarian actions worldwide. In these directions, we participated in research and innovation projects. We contributed to sustainable teaching and training activities. We contributed drafting, submitting, discussing appropriate policy briefs and position articles directed to decision-making activities of European national and local level, focused on improving healthcare and research. The key motto of our association is that better informed doctors make patients better cared for. I will explain briefly the content of 3 of the completed and distinctive European projects in which the European Medical Association was a partner. The first, that was completed in 2021, is the BIOS project, a project with a focus on bioinformatics in medicine. The second project is iProcure Security, that was mainly developed for improving and assuring emergency services and facilities in Europe with the greater possible grade of harmonization. And the third project is the General Data Protection Regulation, which was aimed at defining, detecting, and also suggesting which are the main concerns regarding data protection regulation in Europe. A field very strongly related with all the communication and information activities is the problem of countering fake news and misleading information. This is an urgent problem. This includes the information aimed at exclusive marketing purposes, and this activity must be debunked as much as possible. Our task in this regard is and was also commenting when it becomes known in the media on any unethical conduct of colleagues and of any organizations related with health issues. Our targets are many, mainly medical doctors. We have more than 40,000 associates in the European Medical Association, mostly medical doctors, but our target are also the students, medical students and students of all health professionals, of course, but our target is also general audience. This means that our message and information must be very clear, transparent and simple to understand. The mission. The main mission is the analysis of the unmet needs focused on a patient-centered clinical medicine. We have present both the perspective of the patient and the perspective of the doctor. We strive for suggesting how to guarantee optimal profiles of work for all health professionals. The tools we used and we use are organization of meetings, the General Congress of the European Medical Association, the General Assembly, to provide support or to write directly articles for publications and to perform webinars. Always we have the need of assuring appropriate quality and impact, and we have the problem of providing as much as possible continuous medical education credits to the attendees. Topics and themes must be aligned with the best available practice. Interactions are many and feedback are welcome. Interactions with academic, public and private health organizations, participation in conferences at the European Parliament and in other official policymaker venues, drafting, delivery and publicating policies briefs. This is a very important task because in every decisional place, policymakers needs clear document with clear facts and arguments. In this regard, the critical assessment of current or forthcoming, it means in progress, guidelines in medicine is very important. Relationships with patient association, organizing joint meetings and delivering consensus documents is a very important part of our work. This is a relevant part of the future of Europe, because also in medicine our future is Europe. Few figures for the social media achievements. We have more than 20,000 followers, LinkedIn, Twitter and the Facebook page. And the e-learning achievements mainly by the BIOS project that in 2021 had more than 1,000 enrollments on the BIOS MOOCs. The European Medical Association was a partner of the BIOS consortium and was a partner with other 12 partner organizations from 8 countries across Europe. We created the BIOS Vocational Open Online course on bioinformatics for healthcare professionals. Currently, more than 1,100 learners have been already trained. BIOS created a global community on bioinformatics that continues to grow. A part of the activity of European Medical Association, we disseminated relevant meetings and venues, dates and proceedings, if available, of other associations. We provide also information on our social media and also by email, using our mailing list, on the pertinent European or World Days related with health issues. In this regard, it is very important spreading information on the activities of individual and corporate European Medical Association members. Regarding European projects, there is and there was the availability of European Medical Association for participating in European projects as an active partner. Topics are health, society, innovation and research. How we did and how we will do the dissemination of science information. Disseminating critical reviews and positional documents published by the European Medical Association in medical journals or published expressly as articles of the LinkedIn page. Moreover, we tried to disseminate timely significant articles published in peer-reviewed journals by European Medical Association's members. We are participating at the BIOS Foundation activities and awards for the top-ranked research in medicine and biology. And we are also a partner of Health First Europe, an association with a focus on several critical aspects of medicine worldwide and Europe, for instance, sepsis and antibiotic resistance. Our concern is that the flag of Europe is tattered, but we trust that it can fly well with our loyal contribution. Along these pathways we will proceed also in the future. Thank you for your attention and consider that this is the 34th anniversary of the foundation of the European Medical Association. Thank you.